Imagine feeling like you're constantly failing, not because you're not trying, but because your brain just won't cooperate. This is the reality for many women with ADHD. ADHD, or Attention Deficit Hyperactivity Disorder, is a neurodevelopmental disorder that starts in childhood and often worsens into adulthood. The brain of someone with ADHD struggles to balance neurotransmitters, the messengers that help us focus and complete tasks. In a normal brain, neurotransmitters tell neurons when to work and when to rest. But in an ADHD brain, these signals get mixed up. This results in inattentiveness and a lack of concentration, making everyday tasks feel like climbing a mountain. ADHD primarily affects executive functions, like impulse control and focused effort, which are crucial for achieving goals. For women, the struggle is often internal, masked by coping strategies that hide their symptoms from the outside world because otherwise their behavior would not be socially approved. Did you know that systematic research on women with ADHD only started in 1979? This lack of data has left many women undiagnosed and struggling. Women with ADHD often develop harmful coping strategies, like keeping multiple copies of things to avoid being seen as forgetful. They might arrive extremely early to avoid being late or work long hours to avoid looking lazy. These coping mechanisms can lead to chronic stress and anxiety, making the internal battle even harder. The Diagnostic and Statistical Manual of Mental Disorders, DSM-5, outlines 3 types of ADHD: inattentive, impulsive hyperactive, and combined. Inattentive ADHD is characterized by easy distraction, careless mistakes, and difficulty organizing tasks. Impulsive hyperactive ADHD involves restlessness, excessive talking, and interrupting others. Combined ADHD includes symptoms of both inattention and impulsivity, often leading to more severe challenges. Women with ADHD are often misdiagnosed with depression or bipolar disorder, leading to ineffective treatments. Girls with ADHD are more likely to internalize their struggles, leading to a higher risk of depression and anxiety. Research shows that women with ADHD are more prone to risky behaviors, like unprotected sex and self-harm. ADHD symptoms often resemble other psychiatric problems, making diagnosis even more challenging. Depression is a common co-occurring condition, with girls with ADHD being 5.4 times more likely to be diagnosed with major depression. There are 3 major types of depression: major depression, bipolar disorder, and dysthymia. Women with ADHD are also at higher risk for eating disorders, like bulimia and binge eating, due to poor impulse control. Anxiety is another common issue, manifesting in forms like panic attacks, general anxiety, and social anxiety. Treating ADHD involves both natural and artificial means, including stimulant medications like Adderall and Ritalin. Natural treatments, like sports and yoga, can also help by boosting dopamine levels and reducing symptoms. Somatic experiencing, which combines meditation with body movements, can help release negative emotions and improve well-being. Cognitive behavioral therapy, CBT, teaches healthy coping strategies and can be especially useful for young women and girls. Accurate diagnosis is the first step towards a normal and healthy life, helping you develop a personalized treatment strategy. A supportive community of other ADHD-diagnosed women can provide invaluable help and understanding. While searching for local support groups, try meditation and yoga to experience their calming effects. Remember, you don't have to suffer alone. With the right support and treatment, you can lead a fulfilling life. Stay strong and keep moving forward.